In this video, we listened to Joe Bullingham, General Manager of PoTS UK, and Emily Cochrane, Clinical Exercise Physiologist, discuss the benefits of exercise in PoTS, what that may look like, and the benefits and challenges.
Hi, my name's Jo and I'm the General Manager for PoTS UK.
I'm Emily and I'm a clinical exercise physiologist and I do a lot of volunteer work with PoTS UK.
Thank you. So can you tell us why people with PoTS often find exercise hard?
Yeah, so with PoTS in general, we really struggle to regulate our circulation. And when people exercise, the circulatory demands actually increase. So if we're already struggling to regulate our blood flow and evenly distribute that throughout our body anyway, and then we increase those requirements for things like activities that require intensity or exercise, then that's going to be a lot more challenging for people with PoTS. And we are more likely to see some challenges there with our symptoms if we're not working within a window that's right for us.
Thank you. And conversely, why is exercise so beneficial to people with PoTS or to lots of people with PoTS?
Well, I could talk about that one for ages, Jo, but the key things with this is that with exercise, we can improve our cardiovascular function. So that's really good for improving our circulation, which is great in supporting us with PoTS. On top of that, when we're looking at other forms of exercise, so strength-based exercise, that's going to increase the size and the density of our muscles, which is going to help our blood vessels push that blood back to our heart and increase our capacity in circulation.
Fantastic. And I know this is probably a really tricky question, but what sort of exercise should people with PoTS do?
Oh, that is a tricky one, Jo. So as you would imagine, it can be really different for everyone. So what we hear about the most with PoTS is doing recumbent exercise. So anything that is lying down or in an inclined position, because that's going to take the impact of gravity off the body and make it much easier for us to regulate our circulation. So those could be, ground-based floor type exercises. It could be gentle rowing exercises. Some people that's swimming, but like I said, it's really important to find what's right for us and our window of tolerance around that, Jo.
Fab. And I think people, we've talked about this before, I know, but people often kind of see exercise as going for a run or, something really heavy cardio. And, what would you say to that?
Yeah, I think it's tricky to reframe our perceptions of exercise because unfortunately, when we live with PoTS, we often do have very active backgrounds. So we might have an idea of, what exercise is for us. And like you said, it can be running, walking, doing things where we're sweating and we're working really hard. But the reality is that there are plenty of other forms of movement that we can do that can be really supportive for our body, for the circulatory system, for the muscles. And we don't necessarily have to be pushing ourselves as hard as what we might perceive traditional exercise to be, Jo.
Thank you. What sort of advice should people seek before starting an exercise regime and who from?
So we are all different. So having advice that is tailor-made to us is absolutely key. And with that, we might be looking at support from exercise professionals that specialize in this area, in particular, people like physiotherapists or clinical exercise physiologists who have that really good understanding of supporting people with invisible chronic health conditions. And in particular, who are really understanding of PoTS itself, because there are lots of people out there who work as physios or clinical exercise physiologists, but that doesn't mean that they are familiar with the condition. So it can be great to do your research and make sure that they understand that first.
Fantastic, thank you. I think exercise is a challenge for anybody, let alone anybody with a chronic health condition, and finding a routine and structure and actually building it into your day is, an enormous challenge for lots of people. Why do you think it's so important to set goals for people to, set their own targets to work towards?
Yeah, so sometimes I even reframe that as well. And rather than calling it goals, it's looking at what's important to people, Joe. And when we know what is important to us, whether that's increasing our activity levels, spending time with the family, maybe it is a particular type of exercise, like they're wanting to do some floor-based yoga or be able to walk the dog, then knowing what those things are means that we can be quite specific about what we're working towards. And understanding that we could have those longer term goals, but we could have those really short, achievable goals as well. And that could be, doing one exercise a day. And that's where we start.
Thank you. We have lots of people that ask about post-exertional symptom exacerbation or post-exertional malaise. Can you tell us more about these and who they affect?
Yeah, so these are interchangeable terms, Joe, and they're referring to an increase in the symptoms that we experience as a result of exertion. And that exertion, it can be physical, mental, cognitive. But the key thing is that after we've engaged in those things, we feel worse with our symptoms. So we obviously want to be aware of that to avoid increasing those symptoms. Um, and they are things that people with PoTS can certainly experience. And we also know that PEM and PESE, they can be experienced by people with fatigue syndromes as well. And we want to be really careful because if people do experience PEM or PESE, we don't want to be encouraging them to push beyond their capacity because we know that that can be quite detrimental for them. And we would want to be avoiding things like graded exercise therapy and not engaging in that style of exercise. So particularly for individuals who experience that, we would be seeking some support and guidance from a professional on how to work within their window of tolerance, Joe.
Okay, thank you very much. And if it's somebody who is watching this video and very new to all of this, like, what would you give as advice for getting started? What would be like a few steps to actually getting started and building this into their lives?
Yeah. So firstly, something that I cannot stress enough is that we know our bodies better than anybody else. So listening to our body is the perfect way to start. It is our body and it's our choice on what we engage with and how we support ourselves. But if we're wanting to introduce something like movement into our life and our routine, it's usually looking at the smallest possible increments and going from there, being aware that movement or exercise for some people, it could look like sitting up in bed, Joe, or it could look like brushing their teeth. So when we're talking about those really tiny increments, it's what is applicable to that person. And then, other people, they might be looking at some really gentle floor-based things. So there is no increment that is too small to begin with, as long as we're finding that we're comfortable with that and we're not experiencing symptoms worsening afterwards.
That makes a lot of sense. I do think it's a real challenge in having to reframe your view of exercise or, such small increments. You might think, oh, it's not worth it. But actually, that's what's really making the difference, isn't it? To build up so slowly and to see those, the benefits and the results. But I think it's like reprogramming our brains to allow us to sort of accept that that's the way forward. So thank you so much. Is there anything else in terms of exercise that you wanted to add or anything that you think would be useful for people to take away or consider?
I think just keeping in mind that there's some really good resources on the PoTS UK website, Joe. So not just for supporting the lifestyle side of things, but there is a really lovely summary on there about exercise and considerations. And in saying that, the lifestyle strategies, they can be a really good way to actually stabilize our baseline before looking at introducing something like exercise. Because if we introduce that, we want to do it as sustainably as possible. And yeah, all of that advice and those PoTS strategies, they're on there to support our circulation and help us to feel as good as we can to be in a space to exercise.
Perfect. And do you ever recommend that people sort of keep a written record or on an app or anything like that to track how they're doing and what's worked well? Like, what sort of advice would you give people with regards to that?
Oh, that's a really good one, Joe. So, yeah, I have worked with people who've done this in all different ways. And I guess that's not surprising because we are all unique and we are all going to have different ways that we want to go about that. So, I do have some people that will keep a written journal, or I've got people using a variety of different apps to record things. And the most valuable thing that they're really getting out of that is looking at what did I do and how did I feel afterwards to determine if that is sustainable for them or whether they do need to make some tweaks, changes, or, come to me or come to their other exercise professionals to get some advice on that.
Okay, that's great advice, because I think it's so important, isn't it, to be able to see your perspective and then to see your progress, because on a bad day you can think nothing's improving, this isn't working for me. Whereas if you've actually got it written down, you can be like, okay, this time last week I was in quite a good place, and try and then track what's actually happened, what differences there's been. And I'm a big fan of writing things down. I love a notebook.
I often share this with people, but I live with PoTS myself, Joe, and that's something that I've been doing with my own exercise for years and years and years, just so that I can continuously reflect on it. And of course, everyone's strategies are going to be different, but for me, I've found that that's been really, really helpful. And I think you alluded to this as well. It's not just reflecting on the exercise, but it's looking at everything else that we've got going on in life. Because if we do have a busy day, a stressful day for us, then those might not be the appropriate days to be doing our movement or our exercise because we've already used up our energy in other areas there.
Yeah, I think that's so key, isn't it? Because it's all part of a package. Not one thing isn't going to solve anything or improve anything, is it? It's kind of a collaboration of them all together. So that's very wise words. Okay, fab. Thank you very much.
In summary, it may be necessary to reframe your perception of exercise and create your new normal. Set short, achievable goals and longer-term goals based on what is important to you. Listen to your body, your choice. Do what works for you. You know your body better than anyone else. Whatever you decide, start with small increments. This may look different for everyone. There is no increment that is too small. It is all progress, so be kind to yourself and take things slowly. Exercise is just one part of the bigger picture and needs to be incorporated alongside the other lifestyle changes. Consider how these all impact on one another. Keep a record of your progress. It is so helpful to refer back to these to reflect on what has worked well and what you should change. Always consult your relevant healthcare professional for advice on how to get started or if you have any concerns. For more information, visit www.potsuk.org.